Should I consider active surveillance for DC as breast cancer? Imagine being told you have ductal carcinoma in situ, or DCIS, and wondering what your next step should be. DCIS is a non-invasive breast condition where abnormal cells are confined within the milk ducts. It is often found through mammograms and is considered a precursor to invasive breast cancer, but it does not usually spread beyond the ducts. Traditionally, treatment for DCIS involves surgery, such as removing the affected tissue through a lumpectomy or sometimes a mastectomy, often followed by radiation therapy. These approaches aim to prevent the small chance of progression to invasive cancer. However, recent research suggests that not all cases of DCIS may require immediate treatment. Active surveillance is an approach where instead of rushing into surgery or radiation, doctors closely monitor the condition. This involves regular mammograms, clinical exams, and sometimes additional imaging to watch for any changes. The idea is to catch any signs of progression early while avoiding the side effects and risks associated with surgery and radiation. This approach might be suitable for women with low-risk DCIS, especially if the lesion is small, slow-growing, or not showing aggressive features under the microscope. It is important to understand that active surveillance is not neglect. It is a proactive strategy that requires commitment to regular checkups and clear communication with healthcare providers. Deciding whether to consider active surveillance depends on individual factors such as age, overall health, the specific characteristics of the DCIS, and personal preferences. Some women may prefer to avoid surgery if their risk of progression is very low, while others may feel more comfortable with traditional treatment options. Current guidelines from major health authorities emphasize that active surveillance for DCIS should only be considered within clinical trials or specialized centers where close monitoring is possible. It is essential to discuss all options with a healthcare professional who can evaluate your specific case and help you weigh the benefits and risks. Remember, every case of DCIS is unique, and what works for one person may not be right for another. Ongoing research continues to improve our understanding of which cases might safely be managed with surveillance. Always seek personalized advice from your medical team, and never make treatment decisions without professional guidance.